Well, hello everyone. Glad you could join us tonight. We're gonna have some fun tonight. I got another special guest for you. Her name's Brittany, and she suffered from a condition called PMDD. That's Premenstrual Dysphoric Disorder. Causes all sorts of problems with mood, cognition, and there's a lot of physical stuff behind that as well. And it's got to be pretty difficult when you get some of these things happening. And in her case, she's got a family of four. Fantastic. She's got two sets of twins, age 5 and age 8. The last thing you need to do is have something that's giving you a real challenge during the menstrual period. She will talk about it and give you more details. But I'm so glad you could join us tonight. What we're going to do tonight a little differently as well is I want you to send in your questions. Okay, that's number one, which is not different. But what I would like you to do is for those that have owned a palm light for some time, I would like it and have seen some kind of results. I would like to open it up for audio and sometimes video, if that works, on the fly, which is a little crazy. But all I would need to do is if you wanted to be involved tonight and share a story about how something has improved in your life or somebody else's life because of your involvement with our light technology, I would really like that. But what you'll need to do is you will need to send us in the chat box. You'll send us your the name will pop up, and just a quick description of what the condition was and what device you had, whether it was Palm Professional, whether it was one of these guys here. This is the actually there's the Palm Professional, and then this is the Palm Ultimate. And this is the red 660 nanometer light. And then you switch it up to the 810 nanometer. Okay. And you can see some glowing dots there. That's the 810. And when it comes to the Super Palm 1050, we have the 660 nanometer wavelength, which is as powerful as the Ultimate. But as you can see, it's going right through my hand. And that happens with all three devices, but you'll see more coming through. There's more energy coming through from the Ultimate and the Professional, both in the 660. And then when it comes to the 810 or the Super Palm with the 1050 nanometer wavelength, the 1050 nanometer wavelength has the potential to penetrate a bit deeper. So, and we've seen some things going a little faster. So, by the way, for all those that are watching tonight, you'll be entered in into our draw. And at the end of the month, we will make a draw for beginning of the following month, but we'll make a draw for the Palm Ultimate. That's a $1,300 US device, and it works extremely well. And somebody will end up getting one of these again for at the will be then probably the first week of September. We'll do the draw for the month of August. So somebody will be winning this. I just heard from somebody today that's elated that she was the one who won the unit for the month of July. And she was hoping so much to somehow get a palm light. And she had even called us about maybe we had an old used one or something. And we really don't. People hang on to their units and they love them. So anyways, she was thrilled because she didn't know how she was going to be able to afford getting a the Palm Light, but she really, really wanted for her and her husband, senior couple. And guess what? I believe that God figured they needed the light. So that's pretty neat. Anyways, I'm going to now ask that Brittany can come on, and then we'll start our program. So, hey, Brittany, how you doing?
Hi, everyone.
So, Brittany, just for those, there's a good number of people that tuned in just in the last 10 minutes and or 5 minutes, and so some of them missed the opening intro. So I'll just say, uh, Brittany's on the line with us here tonight, and she suffered from a condition called PMDD, diagnosed from your doctor, and
Yep.
premenstrual dysphoric disorder, and it challenges things with the mood, cognition, and physical stuff. So tell me a little more. So when did you first figure out something was going on that wasn't so great?
It's probably about a year and a half ago, I noticed a shift in my mood monthly. And ladies will know about regular PMS and you kind of come accustomed to it. But something definitely shifted, and I found myself really struggling to cope each month,
Hmm.
and was kind of tracking it and pinning it down to about 10 days before the cycle would start. Um, and I could basically describe it as over the top extreme PMS to the point of crippling you mentally. I'm not talking a little moody. For me specifically, it's not so much the physical ailment of pain, it's all up in here for me. And I found myself struggling to cope with having four children more. I found myself crying and calling my mom multiple times a day. I was homeschooling and felt like I couldn't teach my kids during this period. I felt a shift around a year and a half ago of something was different, and I couldn't pin it on what the heck this was.
Okay. And then what was the final straw that got your husband or got you to go in and get further diagnosis?
Well, basically, when you can't cope and when you feel hopeless, and as a Christian, you just even feel like I can't go on. Something had to change, and speaking with my doctor, doing my own research, you know, um, the immediate answers are given. Yes, this is a real condition. It's not in your head. Birth control or an antidepressant. That's your ticket. That will fix you. And that's what you're given. And I love and respect my doctor for different reasons. And he knows I'm on a different page in terms of how I'd like to target different conditions or things going on with my children. And I said, absolutely not. That's not getting to the root cause of what is happening in my body. And I'm not comfortable with that route. And then they kind of wash their hands of it and say, well, we gave you this route to try, and with all the side effects that can come with taking a drug now.
Yes.
Um, and so that wasn't really an option.
Hmm.
Um, but I'd love to share with everyone how I actually stumbled upon Tom and his red light. Wasn't even initially for this diagnosis of PMDD.
Go for it.
Now, this is how red light is amazing. You think you're treating one thing, and all of a sudden your world's been turned upside down. It's treating a different ailment that you didn't think possible. So this mood disorder is very real, is my reality. But you just grin and bear it. So I'm talking with Tom about ADHD. Now, I had a diagnosis of ADHD at 11 years old. I went on a stimulant drug, Adderall, for 7 years. And when I finished university, my goal was to get off of that drug. And, I did the fish oil, I did all the natural things. My parents are very natural minded, but I needed that to get through. And I finished my university studies. And then life got busy. I became a mom, and I'm on the struggle bus. Now I'm getting by, but barely. a classic ADD person kind of thing. So I'm speaking to Tom about my symptoms and how I'm having this mind fog. I've always kind of lived in a clouded mind fog and inattention and all of this. And Tom suggests red light. I said, there's something in my brain that feels inflamed, I would describe it. And so I started the helmet treatment believing I was going in for ADHD and some brain fog. And it absolutely treated that. I'm here to tell you, every individual experience will be what they will. But my husband is like, what are you taking? Did you start taking something? Like, what's going on? You got so much done. You're productive. You're cheery and focused. You're not ultra sensitive to noise stimuli, the children, all of this. I'm in the kitchen creating all these things, doing the dishes at night cheerfully. I'm on task. And I'm thinking, okay, this thing works. And I'm ready to report back. My brain feels clear. I will tell you that right now. PMDD as well as ADHD, you have brain fog, and you think you just have to live that way. I'm telling you right now, like, I can't make this up. It feels like when you go to the car to fill up gas and you take a squeegee and you clean and clear your front there. That's how I feel. That's how I feel with red light after only a few sessions. I felt like the fog and someone was just taking a squeegee to my brain. Like, I can't make this up. I was like, is this placebo? Is this too good to be true? Let's keep at it. No, that is what it's doing for my brain. And then it makes you think, how inflamed is it in there? So this is my initial red light was treating this. So now it's compounded. It's treating the ADHD, the brain fog. And now all of a sudden, my mom checked in with me, and my mom is an amazing mom. She's used to phone calls of panic during this time of month of, I can't do this. I can't be a mom. I can't. And she called me and was checking in and said, I haven't heard any panic phone calls lately. Like, is it not that time of month or something? I said, wait a minute, let me check my phone. And so I pull my phone out. I look at the app. I'm 2 days to starting my cycle. I started crying on the phone to my mom. I said, Mom, if this is a placebo effect, I want all the placebo effect. But I really hope this thing is working and God is working through this treatment because, Mom, I have never experienced one cycle in the last year and a half where I didn't know I was in this doom phase. So now I'm like calling everyone I know to tell them about it. I'm going, is it just a freak thing? Nope. The next month comes along. Not only is the ADHD, I'm feeling clear on task, but now I don't feel like a monster. I feel like I can be a wife, a mother, a neighbor, a friend. I'm telling you right now, I'm sorry I'm talking so much. It's just unreal. Unreal.
So how did your husband describe you? Did he try to tell you what you were like, or what was his, it's pretty tough for being on that side of
It is tough. And it's tough for your partner, it's tough for everyone, for my kids. Well, even my kids, I said to them, have you noticed anything different about Mummy? And I didn't bring up the red light. And they said, yeah. And I said, what have you noticed about Mummy lately? And this was the second month of success doing this. And they said, Mummy's not yelling as much anymore. Mummy isn't saying she's stressed. And I said to my 8-year-olds, really? And I said, I'm so sorry. Is that how Mummy is often? And they said, yeah, sometimes. And I said, do you see a change? Because Mummy feels a change in her heart. And they said, absolutely, Mummy. And I said, do you think it could be the red light? And they said, it's the red light. Because they go to the appointments with me and they see me and they know it's important to fit it into our schedule. And they said, yes, Mummy, I think it's the red light. And I mean, we're months into this journey. And my husband says it's night and day. It's old Brittany coming back. I'm telling you.
Wow. And it was through my daughter that you got a chance to learn about this stuff, right? That was neat. That was neat that she reached out and cared and said, hey, Brittany, what about this? You want to give this a shot, right? Something along that lines, or what?
Absolutely. Yep. I think it's amazing because when you're excited that something works, when you feel like your options are prescription medication, which it has its place. Yeah. But for someone who strives to live naturally and cooking homemade and doing all these things in a homesteading lifestyle and, grounding in the forest, like the idea of having to take a pill to return to a normal state of thinking, of mood, it was crushing.
Mm.
And so it's like, I love the excitement of people telling you about something that works. And red light seems to treat so many different things related to inflammation. And so to know that there's something powerful that you can place on your head and get a treatment and walk away and feel not crazy is one way to put it. Like, this is night and day. It has changed my life. And so how can you not share about it? How can your daughter not share about how it helps her husband's back pain? Why not try it? I said, I'm going to try it.
Yeah.
Right. And
Yeah.
there it is, treating two conditions in my life that I'm struggling with.
Yeah, that is fantastic. And what I've learned more recently, I would say in the last 6 months, is that so many of the brain issues, when it comes to strokes, concussions, Parkinson's, even autism, and there's a bunch more, brain fog, are all related to inflammation on the brain. So
Mm-hmm.
if you can help reduce inflammation on the brain, which is what we've been able to do with the light technology, then the brain can work better. And
Yeah.
I think you'll recognize this guy here.
Yes.
So this is our helmet, and that's what you've been using. So a person just puts that on their head like this and does the treatment like that. And it has the two wavelengths you used. We did the 1 minute, right? And 1 minute of the
Yeah.
red. And we did then the 3 minutes of the near infrared, which are just those little purplish dots that people see. It doesn't look very impressive, but it's actually going quite deep. And did you notice anything during the treatment? Like, was there any unique sensations or anything like that that you noticed when you're under the helmet? First, there's a warmth for sure, but anything in particular? Just wondering.
Uh, well, it feels like a little vacation under there. It's not too hot, but it is nice and warm. It does feel like a little retreat.
Did
I
you
will
feel more
tell you,
relaxed? Did you sense a
absolutely
relaxation?
relaxed. Absolutely relaxed. So much so that, we have tried it on my son, who struggles with a bit of hyperactivity, undiagnosed. He's 5. But he's asked, Uncle Nick, I want the red light helmet. And he like craves it and wants it. And we've noticed a mood shift whenever my younger son has used it. And this is not diagnosed. This is just, you just gotta wonder, like, what's going on in some of these brains. And I'm not someone who's had a brain trauma. I can only imagine what it could do to someone in a car accident. What it could, like,
Yeah.
this is life changing for a regular person who clearly has inflammation issues in the brain. I only wish that I would have known about this sooner. I could have avoided 7 years of Adderall. If I could think clearly and write my exams in university, do you know what I mean? A natural way to know that I'm getting to the root cause of the issue, not taking the stimulant drug. Like, if I could go back and talk to my younger self, or if I knew about it, I don't like to live with regrets, but like, you want to preach it from the top of the mountain. Like, you do want to share with others. And at first they'll look at you and say, what are you talking about? You sound crazy. And it's like, I'm here getting paid nothing to tell you about this thing.
Yeah.
I need to tell you because if you could feel half as good as I feel after these treatments, and I'm going to tell you, and I know there's a lot of people listening right now. There have been times when I haven't been able to get out to use the helmet for the treatments. I have 4 kids, right? It is crippling, back to crippling. And this is linked to PMDD, and that condition I was speaking about specifically talks about building histamine levels. So people are thought to have like a hypersensitivity, an excess amount of histamine that their body's producing. Now, a naturopath I saw totally put the dots together when I told her red light is doing things. I don't know why, but I'm going to keep going because it's doing things. And right away, she pinned it on histamine being a huge factor for women struggling with PMDD. Still a lot of research that needs to be done, but producing this excess histamine makes the estrogen levels and the fluctuations in a woman's cycle exasperated. It makes it very difficult. So you might have normal hormone levels coming in on your panels, but the way that the brain is able to react to these rising and lowering levels, when you have excess histamine going through the body, it is not good. And the naturopath, tried to pin it to maybe a viral infection from a year and a half or two ago,
Right.
which I did have a really bad case of COVID.
Yeah.
Make with that what you will, but she has seen it where people have gone from not having these histamine levels to skyrocketing. And, I looked at her, I said, does that mean I have to go on a low histamine diet? That doesn't sound fun and everything. And she's like, keep at the red light. It's clearly lowering this inflammation in the brain. If you are seeing night and day difference, there's no reason why you can't stop going on that. There are natural supplements that can lower inflammation, but in your desperate situation and you have access to this amazing treatment, she's like, it makes sense to me why it's working for you. Keep doing it. I just wish more people in the support groups with brain fog, attention deficit, PMDD, like I wish this wasn't so, like, not taboo, but I feel like it's not out there enough.
Yeah.
And when you know something works, you want to sing its praises.
Yeah, and you can imagine this has made such a difference in your life. And recently, I just saw an article from one of the universities, and they just said that this is just all hocus pocus. Like, I mean, they're not getting into the research of this. Like, they're just wiping it and saying, "Oh no, that can't be possible." And then they said all these derogatory things about that. It's just wishful thinking, and man, I bet you wished you could have felt a lot better a long time ago, But
exactly. And I'd
how
love
ridiculous.
to talk to the people saying that. I would love to share my life and ask my husband to come over and speak to them of the night and day difference. If you are living with someone who is crippled by depressive thoughts, by anxious thoughts, moodiness, hypersensitivity to people, you become like a monster. How can you explain it? The only thing I changed was red light therapy. And I'm truly genuinely meaning that. And it changes my mood. It changes my ability to cope as a mother. Like, you can tell me whatever, a pharmaceutical company, they make a lot more money off you taking their birth control or their antidepressant pills to be a lifetime member of. I choose to go to root cause. I choose to live a holistic life. I'm telling you right now, you can't make this stuff up. This is my testimony. This is my lived experience. No one can tell me differently.
That is so beautiful. Brittany, I want to thank you for coming on. And what I'd like you to do is, in case I have a specific question that somebody has, if you could remain on, if you have a look, can you remain on for another half hour or so?
Yeah, I can remain on for a bit. Yep, as long as the children allow.
Okay. All right. We'll mute you and we'll turn off the light. Turn off the light. Turn off the video. And then I'll get into some of the other things, and then I'll be looking through some of the questions and answers that are coming through, and we're going to do something very interesting tonight, allowing some people to talk like yourself just on the Zoom link as to what they've made it, how it's been for them. So, all right. Okay.
Yeah.
So, we got one quick question. Oh, what Yvonne is asking. Yvonne, thank you very much for your chat here. What was Brittany's daily protocol? Okay, Brittany, what was your daily protocol during using the light? I gather, or
yes,
that's the only thing that changed. So you go ahead. You
yeah,
used a few times.
The only thing that changed, I would say, when it was the most effective was 3 times a week. I also was doubling up on the treatment. So 4 minutes is the standard. I worked my tolerance up and found I could take 2 4-minute sessions. Just because I can't have access to it every day as well. And because it feels good and I trust my body to give me feedback. I was doing the 2 4 minutes of the 1 minute and then 3 1 minute and 3, at least 3 times a week. And I'll tell you right now, when I went a week without it, especially around that luteal phase of the cycle, it crept right back in. And so I could feel the difference in my brain without the red light. I unfortunately experimented without meaning to. I just couldn't get out to get the treatments. And so for me, in my particular circumstance, for the alertness, for the focus, for the ADHD, as well as for the PMDD, I need to be a regular user.
Yeah.
And so my protocol would be at least like the 3 times a week. The double treatment I could tolerate and felt good.
Mhm.
And that was the only thing that I changed. I mean, I've tried exercise, all the natural supplements. I'm telling you, this is the protocol with simply using the helmet multiple times a week.
Yeah. Okay.
There's nothing
Well,
fancy to it.
Brittany, thank you. That's great. Here's another question for you. Britt, do you still have pain or inflammation from time to time? And there's a question, and it says, "Oh, wow, thank you, Brett." So there's that's from Deborah, just thanking you for coming on tonight. And Yvonne also says, "Excellent presentation." So
Mm.
thank you.
So
Um,
I didn't have pain to answer that question.
okay,
I don't necessarily have the monthly pains. If I did, I would be trying to get my hands on the mini panel, the mini canopy. What's that product called? I'd be trying to get red light going on my abdomen personally, and trying that to see,
with the palm light, yeah,
or the palm.
yeah,
I would be using that. I can't speak to the pain. For me, it's the mental anguish.
yeah. Okay.
Sorry, I can't speak to that.
All right, I think we're good with the questions. If there is something else, if you're still on, we'll ask. But otherwise, thank you for coming on tonight, and that
No
was
problem.
absolutely excellent. I'm sure you have been giving people hope that this will be played to others that probably aren't have gone through what you have been going through. So, thank you
No
very
problem.
much, Brittany. So Penny, I'm wondering, would you mind coming on for a minute? I'm gonna ask you, and I just wonder if you'd be able to do that and just talk with us about this person you're mentioning. It's up to you if you'd like to do that. Um, oh, there. Okay. So tell me about what experience you've seen with the light.
For the Palm Light, I've got the Palm Ultimate, the 1050, and I was using it with my husband, who's pretty much desperately in need of a knee replacement. But he's got a summer job, so he wanted to kind of eke it out until the fall, where he could not get the knee replacement until the fall. And so, when his knee bothers him a lot, he's able to put the palm light on it for just like 20 minutes. We'll do maybe like 5 minutes of the red and then 15 minutes of the infrared,
Yeah.
and completely eliminates his knee pain to where he's able to walk on it for 3, 4 hours without having the pain return. So that's really been a blessing.
Oh, that's great. And did I see up ahead in one of the chats here, you also knew somebody with that might be somebody else. Sorry, that was somebody else with a let's see, sorry, somebody with a helmet. That wasn't you, right?
No, we have the helmet as well. And
Okay.
I'm a physical therapist, and so I've been using it with different people. This particular was my neighbor,
Okay.
who had been diagnosed with PTSD a number of years back, and he had pretty severe anxiety with it. If he'd have any disruptions, or something wouldn't go right, he'd get very agitated about it, and he'd get the shakes, and he was basically unable to do anything else for the rest of the day. He was just so consumed with
Right.
anxiety over what had happened. And he just like after the first treatment, even he noticed that the anxiety was greatly diminished. And after about 4 weeks, his wife, we attend a craft class together, and she goes, "I don't know what you've been doing, but the other day she accidentally left the water on, and they ran the cistern out of water." And she's like, "He's going to be so mad. He's going to be so mad." She was just dreading it. And then finally he's like, "What happened? We were out of water." And she's like, "I know, I forgot, and I left the water on." And he's like, "Oh, yeah, I've done that too. No problem." And she's just like, "Who are you, and what happened to my husband?" Just so
So
easygoing about it.
very good experience. So we had an individual, we had a webinar, this goes back a ways, but the fellow calls this his happy helmet. because he had PTSD and severe war vet, and struggling with super depression, super anxiety, on meds, all sorts of things. And he has been able to come off all meds. And he says, I've got no depression, no anxiety. He says, I'm a new person. Like he
Yeah.
was so happy with that. And I think that's cool. That's really neat. Well, Penny, any other thoughts of the palm light? Anything else you tried it on, or nothing comes to mind?
Um, yeah, I mean, I've tried it on a lot of different orthopedic problems.
Yeah.
After I would treat them with the physical therapy, then I use it as an anti-inflammatory, and it's better than throwing ice on something. It works way better. It's more comfortable. People enjoy it more because it's kind of a warm, soothing feeling.
Right,
So
right.
I've used it on shoulders and necks, the palm, um, elbows, knees, wrists, all body parts.
Yeah, that's and there's now some newer learning that's coming along that's saying about how actually ice slows down the healing process. So
Mm-hmm.
you may get rid of some inflammation, but you're actually slowing down, so using light therapy, you're keeping the speed up, actually improving the healing speed. So you'll be out
Right.
of the situation much faster. And I know that I've worked with a athlete for the Olympics, and she does a crossbow, and she's pulling 42 pounds of force, and
Mm.
she's doing that like 300 times a day. Oh, and I left out the part, she's 70 years old. Okay.
Yeah.
They call her grandpa in the Olympics because she's done this so many years that she's competed. And she used to be on the sled, the luge. And then she couldn't do that movement anymore. So she went to archery and was able to master archery. So she was able to keep her fingers going by using the light prior to the every time the workout and after, to reduce, get the movement and get rid of the inflammation. So I want to thank you so much for coming on and sharing that with us. That's fantastic. Okay, so the protocols for the helmet is we suggest 1 minute of the red and 3 minutes of the near infrared. Now I do have some biohackers. If you're worried about safety, they have the biohackers have gone to like much, much longer periods of time. Well, I'm not going to suggest people do this, but they did 15 minutes. And yeah, so I see Yvonne is mentioning something. Yvonne, would you like to come on for a minute if you're okay with that? Okay, so sorry, I thought it was I misread that, Penny. I'll answer your question, or Yvonne. I'll answer this question for you. There's a person, you have a friend that has ankle surgery and developed scar tissue and has to have more surgery to remove that. Have you treated that type of problem with your light therapy? So as it turns out, the um, as it turns out, the light therapy can help prevent scarring it works extremely well to prevent scarring when surgery is taking place. So, or just after the surgery. And so a person would use it on a regular basis. It is my understanding that it can also help the cells, to slowly get rid of scar tissue, but that's a slow process after an event where scar tissue has built up. I can tell you that there was a girl. I know some might have heard this before, but there was a girl that lived next door to my daughter, and she was with her friends, and she ended up having fun in the tree with a rope. Only the rope ended up lassoing her hand and tearing off the tip of her finger. and the surgeon had said when he shortened the bone and stitched it back together that there would be multiple treatments to try and get rid, multiple surgeries to try and get rid of all the scar tissue that would normally build up as it's trying to heal. And anyways, what happened is she started using the light immediately, and on her 2-week review, there was no scar tissue, no other surgeries required. So as soon as they were able to use it right away with the light, you can prevent that scar tissue much easier than if it's laid down some scar tissue and you're trying to get rid of it later. So it's Birgit. Birgit, I'd like to share a story. Birgit, if you'd like to come on, and we'll invite you in.
All right. Can you hear me?
Yes, we can. Hey, there we
Okay,
are.
can you see me?
Yes, we can see you. Hey,
Hi.
thanks for coming on with an impromptu meeting, and thought I would open it up for a few people to comment as to what they've used their devices for. So you got a
Right.
1050 nanometer palm, the
Yes,
super
and I
palm.
use it on a lot of conditions. I've used it on severe pain in the gums and the teeth, and chronic tonsillitis and tinnitus, and other injuries with really amazing results. I have a lot of tools and other things I use, but this seems to work quick, amazingly quick. But the story I want to share is about my dog. You've met us at the New Life Expo, remember? And
Okay.
my little dog Haley, you want to get him?
Yes.
He actually got really sick, really sick. He was coughing, and I thought it was just a little cold. But and I called my vet, and it was a strep staph infection, turns out, and allergy. He had three things combined. What was scary is he couldn't breathe. He could not breathe. He was coughing nonstop, gasping for air, and his heart was pounding. I thought he could have a heart attack. We had a friend who recently, her dog died with the same condition at the vet. It was too late, and they put the dog to sleep. Now here's little Haley, and he
Hey.
loves the one. By the way, I've given him treatments prophylactically for his brain so he doesn't get dementia and Alzheimer's. He's an older dog. He loves it. He lies on his back. So he was used to it. So what I did when he got really bad, because we had to go to the race to the vet, 3 hours away, and I treated him 4 or 5 times a day for a minute each on the red and then the infrared. And
Yeah.
after I did it, there was a couple of moments where he actually could breathe. I think it saved his life, to tell you the truth. We were in a panic. We tried to stay relaxed. And he had to go on medication, penicillin, which works well, but
Right.
we weren't there. And the night before, he was like, like he just couldn't breathe, and his heart was pounding. He's a little dog, and they can go really quick. So I just treated him like maybe every hour, a minute on his lungs, on the belly,
Right.
on the back. And he let me do it. He liked it. And then he was able to breathe a little bit and get some air in there. And by the time we got to the vet, they actually shoveled us in the room thinking he had kennel cough. He didn't have kennel cough. He just had severe bronchitis, a lung infection, allergies, and he has a little bit collapsed trachea. So it came together, but he could have died. And a lot of little dogs do die from this. If you don't make it to the vet in time, he's 12 years old. So I was just pumping the wand on him. I didn't even know how many times, a minute each. And he relaxed. And by the time we got to the vet, then he got the penicillin after 3 days. She took x-rays. Yes, he had bronchitis. Yes, he had everything that I thought he had.
Yeah.
He had, and she said, "Oh, it's really bad. Wow. It was a close call." So I think if I didn't have the wand and persistently used it throughout the day and the night, it could have been a different outcome. I totally could see how afterwards he was able to, for a couple of moments, get some breath, and he was calming down. It relaxed him. He loves it anyway, so it wasn't new to him.
Do you ever? I've heard of pets. Actually, one particular cat in particular. The fellow at first, the cat was very skittish of the light, but then after the light was used, if he turned on the light, the cat would come from its cushy bed underneath the light because it loved it so much. By the way, you mentioned tinnitus, or tinnitus, however you pronounce it. Somebody saw a little bit of improvement on that, with that.
Yeah, actually, a few people, and I actually have a question for you. I put it on the outside. I do
Yes.
the 1 minute and the 3 minutes,
Yeah.
and around the ear.
Mm-hmm.
And also, I have the palm, so I do the whole head, the front, the top, the back. I don't have the helmet, but I'm used to using devices, so I do the head, and then I put the probe in the ear.
Right.
And one of the people, he got the device. I told him, do that. I taught him how to do it, and then put the probe inside the ear with both lights for a minute.
Right.
And I mean, you have to do it for a while. This is a very serious condition that actually hardly anybody has a cure for. It's multifaceted, but I see an improvement from using the light. So I have to watch it longer. I can't tell you yet, what the outcome is, but I definitely see a change from it.
Beautiful, beautiful. Well, Birgit, am I pronouncing your name properly, or how do you?
Yeah, Birgit is good.
Okay, Birgit, thank you so much for coming on and sharing. That's helped some other people understand what the possibilities are here. So great. Thank you so much for coming on.
Yeah, thank you.
Okay. My son has result with eczema. Oh, I hope. Okay, Kimberly, would you like to come on tonight and share about a skin condition, I believe? Okay, so Kimberly is going to come on for us tonight. For any women that are joining us tonight, don't worry about if you had a bad hair day. It's okay. Share your story. It'll be encouraging to others. So even if the hair doesn't look perfect. All right. Well, you got curly hair. So tell me, what did about your situation? What have you been able to see, or whoever's condition that is?
Okay, so I do have a palm light. I think I had it, I think since 2023. I was up in Hamilton at your place, and I had gotten a palm light from you. I don't know what the strength is right now.
Okay.
But, and I know you were talking about ankles earlier, and
Yes.
I'm glad the explanation that you did give, because I'm using it for my ankle injury. And as you rightly said, that if there's scarring there, if you didn't get the light on earlier, it will take longer. So I mean, like for me, I do see that, like I still have some pain, but my injury is 10 years old, 11 years old. So unfortunately, it's taken a little longer for that. But I needed to talk about my son who has eczema, and he had eczema since he was a child. And recently he came to me and he said to me that, his brain wasn't working well, and something at the start he was having, not really being indecisive and stuff like that. And then one day I kind of was preparing for work the night, and something said brain fog, and it said his gut probably is the issue. When I looked at his hands were all really, really bad with the eczemas.
Right.
And he was even bandaging his hands so as not to scratch them, And so I did decide, okay, we'll have to work on the gut. And I heard that your lights, you talk about using the light on the gut as well. I said, we'll have to work on the gut, but I said to him, we will have to use the light as well. And we did. And and I have documented pictures of them. So when I will send them to your office.
Oh, I would love to see them. Yes.
Yes,
sure.
and I showed them to Winston last week, and within 2 days, as an adjunct, his hands and his back were completely different. Using the red, the inflammation was gone, and you will see I have them dated, so I will send them to you.
And you were tell others how you were treating your son. Like, where did you place the light then?
So I placed the light on his, and I think I'm not sure if I used it right. I only used the red light. That was, I think, the one he used, because I figured it was superficial. It was the inflammation on the skin. And he used it on the body part that had the eczemas.
Okay.
Both his hands, his arms, as well as his back.
Okay. All right. And now, you did something as well to improve his gut, or did you?
Yeah. So one of the things that we did for him, because he was off dairy for about 10 years as a kid, because of his, we recognized that the eczemas, of course, was brought on by his gut issues. And so he was off dairy, he was off wheat. So we went back, we took him off back dairy and wheat. But one of the things that we did is that we were using some supplementation to help his gut heal.
Mm-hmm. Good. Excellent. Yeah. Combination therapy is fantastic. And how many minutes, there's a question from Yvonne, how many minutes did you treat him with the light over the skin area?
So one of the things, he had it on for a very long time. He was watching TV. He was it's a 22-year-old young man. He was watching TV and he just had on that light. So it wasn't, it wasn't directly like over his hand kind of stuff, but he had it there. It wasn't that it was burning him. He just had on that light. He just went overboard.
But it doesn't matter. That's beautiful that I was able to help him that way. So I want to thank you, Kimberly, so much for coming on and sharing your story as to how the light has been able to help that condition.
I can share another story too. I was talking to my sister who's in England, and you know her, and she uses the mini canopy for her back.
Right.
And I spoke to her last week, and I asked her, how were you doing with a mini canopy? And she said, it's set up by my bed. I use it morning and evening. And she also said, but what I've noticed is that I'm able to come off two doses of my pain meds. Instead of 4 doses, she's able to come off of 2 doses of her pain meds. And she seems to be liking the treatment as well.
Yeah, and she's a nurse, so she totally follows things very, very carefully. So
yes,
if she's been able to come off 2 doses, I'm sure she knows exactly what she's doing. I have another woman in Scotland who used the light on her knees, a senior woman, and she wasn't sure at first, but she used it, and now after all these years, she doesn't have pain in her knees. So it's neat. It can help a lot of people. So thank you. Doesn't matter if you don't have to be in North America for this light to be helpful. It can be in other parts.
I can share my story. One quick story. I had something in my hand, a palm of my hand, and I wasn't sure what it was. Probably it was a ganglion. I'm not sure what it was. And I was very concerned about it because it was coming to the point it was hurting so much. I thought I would have had to go to the doctor. And I'm like, oh my goodness, if this is to be excised, I'm also a nurse, and this is my dominant hand. I can't afford an excision on this hand. And I used the light. On May 29th, I took out a picture of this hand. I had my husband feel it, what it was there. I started the palm light. I probably used it for about 2 weeks. It's gone.
Yeah, that's beautiful. Well, thank you very much for coming on. That's great. Appreciate it very much. Okay. All right. Bye for now. Well, I think we've caught up with our questions, and that was kind of fun having some people talk about their what they've used the light for, and that's fantastic. So, all right. Well, thank you everyone for joining us tonight. We'll be on next Tuesday as well. And what I'd like you to do is please remember, go to SunPowerLED go to the YouTube channel and subscribe under the SunPowerLED channel on YouTube. And if you do that, what will happen is that you will be able to be notified when the next video comes out. So it's great for that, so you get it when it comes out fresh. Right away. There's a new one up. And also, if you don't mind, if you particularly like a particular segment, maybe it's on tinnitus, or maybe it's on diabetic foot ulcers, maybe it's on one of the other ones, hit the like button on there. And the reason being is when you do that, it helps people it helps the system of YouTube to identify that, there's something worth sharing here. And just by hitting that like button, think of how many more people might be helped just because you hit that like button and they found out about us through you pushing that like button. So please do that for me. As well, remember, everybody who's been on tonight will get a ballot for watching tonight. And I just want to, I'm glad you could join tonight. And if you know of some people that are having some kind of health crisis, dealing with something that's been chronic, have them watch some of our videos and encourage them to go there. And yeah, some people will probably say, that'll never work, and they'll stay in their position of not getting better in that situation. But in this case, you could be instrumental in helping a lot of people around you. So all the best to everyone who joined us, and I wish God's richest blessings on your lives. Thank you again. Have a great week. Bye for now.